Orthopedic and general surgeons at the Georgetown Public Hospital and the New Amsterdam Regional Hospital have embarked on an initiative to reduce the backlog of persons requiring hernia surgeries in Guyana. Delicia Haynes tells us more.
A total of 64 hernia repairs were completed over a weekend period on 50 persons. This brings the backlog of needed surgeries down by 70%. This is according to GPHC CEO George Lewis. Patients both young and old benefited from the intervention wherein guinal hernia repairs were done. Lewis clarified that though there are persons still to undergo the surgery, this is not necessarily considered a backlog. His observation was supported by Head of General Surgery, Dr. Navendranath Rambaran.
We have a prioritization system, and it's based on that prioritization system that the backlog is created. For example, if we have a motor vehicle accident and someone comes to the hospital and they need emergency surgery, obviously if you have a surgery that is programmed, that surgery will be cancelled in order to accommodate that person.
Unless a surgery is done immediately when a patient comes to the hospital, whether it be in the outpatient setting or the emergency setting, then there is an inherent backlog once it's not done immediately, right? In that context, these surgeries perceivably would have been done for each of these patients maybe by another 3-4 months. Does that represent a critical backlog? Not necessarily.
Looking towards 2019, the hospital's administration is hoping to initiate Phase 2 of Operation Hernia and a new initiative, Operation Fibroids. These initiatives are geared towards rendering surgical intervention to those in need not only in Georgetown but throughout the country. For InfoHub, Delicia Haynes.